Well, good evening. Welcome to our fourth broadcast around COVID and its impact for our borough and our town of Warrington. I'm joined this evening by Councillor Russ Bowen, the leader of the council, Thara Raj, who's the Director of Public Health. I'm very pleased also to be joined this evening by Professor Simon Constable, Chief Executive of the hospital here in Warrington, and also Andy Davis, who's the Chief Clinical Officer of the Warrington CCG, and he's also a GP himself. And I think that just shows by the fact that we're all here tonight how joined up we are and how harmoniously we're working together around trying to beat the COVID bug. I would just say a few words about where we're at here at the moment in terms of Warrington is a high risk area. The government have come up with three categories: medium, high and very high. Warrington it was decided that Warrington will be in the high risk category, and we had considerable discussion with government over the weekend and earlier in the week about that categorisation. So what that means is you mustn't socialise with anybody outside of your household or support bubble in any indoor setting. This means no household mixing in pubs, restaurants or at home. You must not socialise in a group of more than 6 people outside, including in gardens and parks. Schools, workplaces and places of religious worship remain open, and you can still travel to venues or amenities that are open for essential reasons like work or education, but you should try and reduce the number of journeys you actually make. If you want to see further details about the restriction within that high risk category, please look at the council website. So over to Russ Bowen, please.
I'll start tonight by doing what I always do, which is to thank the people of Warrington for the tremendous efforts they continue to make in dealing with this COVID crisis here in the town, complying with the rules and regulations, and obviously doing our best to deal with this situation as a borough collectively. Stephen, you've already mentioned about the government conversations that we've had and listening to our thoughts and ideas regarding the COVID situation here in Warrington. And it's important that we recognise that we're having that engagement with government, that they do listen to us as the local leaders here in Warrington, and they agreed with us about placing us into this high category, what is otherwise called Tier 2, and not being placed in Tier 3 along with our colleagues in the Liverpool City region. What this does is it gives us a fighting chance really of bringing down our case numbers, and without the devastating impact of closing down our hospitality and leisure sector locally. And we were really concerned about the impact that those Tier 3 type restrictions could have here on our local economy, particularly for those businesses which have already been hit once by the previous lockdown through to July, and obviously the potential impact on jobs for people here in Warrington. And of course it's a sector which traditionally isn't very well paid, often it's minimum wages, and what we couldn't really agree to was a Tier 3 type lockdown of those premises without adequate financial support coming from government. And I'm afraid that at the moment that deal doesn't convince us that it's the right thing to do for Warrington. So Tier 2, this high risk category, we believe is the right decision for Warrington at this point in time. But we have to recognise that it is a very fast moving and fluid situation. And at some point, unless we get the virus under control here in the town, it might be that we have to step up to Tier 3 and take on additional restrictions. This current decision gives us that time to protect jobs, and it also makes sure that there are regulations in place that try and limit the spread of the virus. And it's more important than ever that people follow the rules, they follow the law, and they follow the good advice and guidance that they can find from government websites and obviously the council's website. I would ask everybody to remain vigilant. Our case numbers are still stubbornly high. We haven't yet managed to turn around the increase in cases here in the town. And the last thing that we really want is a Liverpool style shutdown. So I really urge people to make sure that they're doing everything they possibly can to protect themselves and their friends and family and all of their loved ones. And what we need to reassure people is that those people who continue to break the rules will have appropriate enforcement action taken against them. Hopefully viewers will have seen in the newspapers and the media over recent days a number of fines of up to £10,000 being handed out to those who flout the restrictions in the most serious ways. This is the reality of the situation that we face ourselves in, and it reflects the seriousness of the situation and the measures that the police and the government and other agencies such as ourselves are prepared to take in enforcing the rules here in Warrington. There will be an increased enforcement presence around businesses and hospitality, and that's really important to ensure that those premises within the hospitality sector remain absolutely COVID secure, that they are safe for residents to go and visit, and that they have all the support they need to follow the COVID rules themselves. And we'll be looking to provide additional enforcement as and when required. It's really important as well that our colleagues in Cheshire Police are involved in enforcing the law, and they'll be providing targeted enforcement support alongside the council, and they'll be using a COVID car as part of this focused, targeted additional support. And now with some additional funding from government, the council's also in a position to bring in some COVID wardens here in the town, and they'll help to provide reassurance to people using facilities in the town centre, but obviously to add additional enforcement weight as and when required. So once again, in closing, please keep doing your bit for yourself, but most importantly, keep doing it for all of those people here in our community who are elderly, who are vulnerable, and who may well become extremely unwell if they get the virus. Thanks as always for your continued support.
Okay, thank you very much, Russ. I'll move back now to Tara. I think we've got you back on sound now, Tara. Over to you, Tara. Thank you. Okay, I'm going to move BBC style then, because we haven't got you back, I'm afraid. Move to you, Simon. Thanks for joining us tonight, Simon. Thank you.
Thank you, Steve. Thank you for inviting me to join this evening. It's been a really prominent feature, I think, of how we've managed this as a community, that we've come together like this to manage the pandemic together. That's been a hallmark of how Warrington has handled this so far, and I hope that it will continue to do so. I'm very pleased to provide you with an update in the situation at Warrington and Halton hospitals currently, and I'll be very happy to take any questions at the end. The situation at Warrington and Halton hospitals is escalating pretty quickly, actually. On the 1st of October, we had 29 inpatients with COVID-19, of which 7 were in our intensive care unit. As of this moment, we have 83 inpatients with COVID-19, of which 12 are in our intensive care unit. You have to bear in mind that our intensive care unit is typically configured to have no more than 20 patients in it under normal circumstances. And of course, there will be other patients who aren't COVID positive being looked after in intensive care as well. We are looking after all of our patients with COVID-19 at Warrington, although we do, of course, have Halton Hospital as well, of which I'll talk a little bit more in a moment. In terms of context, I think it's really important to remember where we were at the peak of the pandemic, which was exactly as predicted, being over the Easter weekend. And at the peak of the pandemic, we had 124 patients in total who were COVID-19 positive, and 22 of those were in intensive care. So we're very rapidly approaching that figure that we saw back in April, and clearly it is of concern that we're getting there, and we're getting there so quickly. If you can think about what's changed over the last 2 weeks, fortunately, doesn't appear to be as fast as rapid escalation back in the first wave of the pandemic, but nonetheless, those figures are increasing at a rate which will be difficult to manage. In terms of concerns that will inevitably emerge about the levels of ICU capacity and general bed capacity we have got escalation plans that are very well tried and tested. They were tried and tested in the first wave, and I have no reason to do otherwise when it comes to the second wave. And at this moment in time, we have a total of 26 intensive care unit beds in our current configuration, and we can increase that as required. I said I'd talk a little bit about Holton Hospital, because we do have the ability at Holton Hospital as our cold elective site to keep our planned and elective procedures going for as long as possible using COVID secure methodology and what we call green pathways, which include pre-testing for procedures and a pre-isolation period before procedures carry on. And that, of course, is very helpful when it comes to doing those things that we were unable to do in the first wave of the pandemic, which is all of those elective procedures that would have otherwise been cancelled. We've also taken the decision this week to open Ward B3 at Holton Hospital to take a proportion of patients who are medically fit and no longer need to be in hospital, so that more beds can be freed up at Warrington to provide for any surge that is occurring. I would reinforce that at the moment we're carrying on our elective procedures as normal, and we will continue to do so for as long as possible to minimise the interruption of services for as many patients as possible. We also are carrying on outpatient services as normal. Under the vast majority of circumstances, we're offering outpatient appointments by both telephone and video to save patients from having to come onto the site if they don't need to. But similarly, if that's required, then we'll make it as safe as possible with regards to our COVID secure outpatients facilities. We are clearly at a pivotal point in this pandemic, and we are working with everybody in the local economy to keep our hospitals functioning as appropriate under the circumstances. And I think it is incumbent upon all of us to do all we can to follow the restrictions set out to prevent it getting any worse. I would urge the public to carry on to attend their appointments as they plan to do so. We're taking significant steps to keep services on track, and we'll notify of any changes to that. But together, we do believe that we can carry on as far as we possibly can to deliver normal services for our patients, look after our staff, and protect our hospitals to give us the best chance of coping with the second wave of the pandemic. Thank you.
So, Simon, thank you very much for that update. I'll now move to Andy Davis. And Andy, good evening, Andy.
Good evening, Stephen. Thank you very much for inviting me along. So, as you said, I'm Clinical Chief Officer for the CCG, GP by background, and I was here primarily to talk about what's been happening across the practices in the town over the past few months, and also to commend colleagues who've been able to maintain services through what have been really difficult circumstances. The primary drive behind what's happened in the practice has been to look at focusing on continuing to provide care similar to the green pathways that Simon mentioned in Holton for the most vulnerable people that we have in our town, and sick people who need that care, and that has to be done in a COVID safe environment. So a lot of the changes that have come along are driven by that need. Understand that can be confusing because the custom and practice that people have experienced with being able to drop into practices has had to change, and that has caused some anxiety as well about what might be happening and coming up over the next weeks and months. But practices are there to support patients with all their health needs, and I know that patients and patient groups have been really supportive of helping practices do what they can so that GPs, nurses and other healthcare professionals can continue to provide that valuable care that we need. So in that context, there have been changes, and some practices have had to do things such as lock front doors to make sure that there's not footfall. And again, that's to preserve the waiting spaces in a COVID-free way. Patients who have COVID symptoms are also asked not to access practices, and there are other specific ways that their care can be delivered in environments which are more suited to that and have higher levels of personal protective equipment for the staff, and also have specific cleaning regimes to keep those environments safe. But it's important to know that all practices are still open. So even if the doors might look closed, they aren't closed for business, as it were. They are still open, and there are routes into there. So as part of that COVID safe practice, anybody who comes to practice is going through a few layers of triage, if you like. It's called total triage, and that can either be delivered on the phone or via e-consultation. And then if there's a need to have a face-to-face assessment, so see somebody in the practice, nurse, doctor or other healthcare professional, then there'd be an arrangement made for an appointment at a specific time. And all of that is done to make sure that there aren't too many people in the building at any one time. Also, the practice have to track, as part of the national operating procedures, who's in the building at what time, in case there is a subsequent outbreak or any problems linked back to the practices. And that's driven a lot of those changes. So with that, we've put on a separate service so that if people do need to be seen who have COVID, often that's been arranged to be delivered in somebody's own home if they have a medical need to be seen. And that's the way we've had to structure that in the short term. And if ever anything changed with that, there'd be communication. There's a lot still routinely happening for you all. So immunisations for children, shingles, influenza, pneumococcal infection, those vaccination programmes are all still going. Our smear, essential blood tests, baby checks, new mum checks, and the ward rounds in care homes, and other essential activities such as critical paperwork for assessments. That's all carrying on, and that's still being done. There are some things though that have stopped, and this is part of a national programme of what's called the Standard Operating Procedures for Primary Care, and those things like travel advice and travel vaccines, they've stopped. Obviously there's not much demand for that at the moment. Friends and family tests and other surveys such as that have stopped. Non-essential blood taking stopped. Routine medication reviews where it's not necessarily for the continuation of that medicine, they've been stopped. And other routine appointments such as some of the general health and wellbeing checks have stopped as well, unless they're important for the ongoing management of that person, or that person already is in a high risk group. So those are the only modifications really that are there. There have been some concerns raised about medication supply. At the moment, medication supply is fine. There aren't any shortages, and people should order in the usual way through the use of technology app. There are some patients who've got special exception to be able to phone as well if they're unable to use that technology, and then those prescriptions can be collected from the nominated pharmacist in the usual way. Flu vaccine programme, I think we have a question later about, but that is a priority at the moment, and obviously there's been a change as well, an extension towards other age categories, which I'll come back to later. In terms of what support's in place for local people, there are a lot. The main issues beyond the COVID outbreak and the illnesses that's been causing are much more around mental health issues, depression, anxiety and other things. So we've got a good range of services available in Warrington, and they're there for you if you need them. So Talking Matters is one, and they will be able to help anybody who's registered with a Warrington GP deal with any health problems, and you can find them online at Talking Matters Warrington, and there's a good link there that you can get through, self-refer. There are referral forms, and obviously if you were seen by a healthcare professional, they could get you seen there for things like panic disorders, phobia, OCD and PTSD. they've got good range of skills to cope with those. There's also some general mental health and wellbeing services available, and if you search for Happy OK SAD, that'll take you through to our local website, which will signpost people to national and local resources for both adults and children that will be able to help with any sort of concerns that you might have about lower level stuff that you're just not worried that you're not quite feeling right, or that there might be something that you need to start to address. And then for anybody else who really does feel that they're in mental health crisis, whether you're known to mental health services or not, there is a mental health crisis line that North West boroughs have been operating for us and doing very well. It's a free phone number for adults and children, and that's available 24 hours a day, 7 days a week, and the number's 0800 051 1508. And obviously, if there's any notes to follow this, we publish that, but it has been widely publicised, and if anybody is in crisis, that is there for them. So that's all I wanted to say, Stephen, if that's okay.
Yeah, that's fine, Andy. Thanks for a very thorough update.
No
I think finally now we can go to Tara Raj, our Director of Public Health. Tara.
Thank you. I'm hoping everyone can hear me this time. So I'm Tara Raj. I'm Warrington's Director of Public Health. My concern is the people of Warrington, to keep us all healthy, safe and happy. I live in Warrington. My daughter goes to school in Warrington. I'm invested in Warrington. So how can we tackle the absolutely high infection rates that we're seeing currently? That's the question. The point is that over the last 7 days, we've had over 700 new cases of coronavirus. That is astronomical. We were going, after the big peak, we were going like this. And then we hit the bank holiday weekend in August, and we went like that. We went like that, we went like that, we went like, and we're still going up. We're whooshing. We're not stopping, and that's of a real concern. So you know what to do, I know what to do. Sometimes it's really difficult, life gets in the way. You go out, I mean, I've done it, you go out the house, you forget your face covering, I go back, you know, we all do it. So we've got to start thinking about how we can keep safe, how we can keep each other safe, how we keep our families safe. So you've heard it before, I'll say it again. The most effective way is to keep our social distance, keep us far apart from each other in a loving and caring way. That's going to be difficult because you just want to give somebody a hug. I mean, you know, I don't know you, Simon, very well, but I just want to give you a hug and say, you know, get well soon, sort of thing. So it's those sorts of things. We've just got to be thinking, how do we do things differently? Not what we can't do, but how we can do, how we can do what we want to do. How we can keep, you know, keep things like the hope of Christmas going. We've heard from Russ about the COVID community support officers. They're going to be on our streets from this weekend. Let's be kind to them. They're there to help us to keep the rules and to keep us socially distanced, to make sure that we're wearing face coverings if we can. Some people have a medical condition and they can't wear them. So let's be kind to those people. Some people actually look much older than they actually are. So let's not make too many assumptions about why somebody isn't doing what they're doing. Let's all do what we're supposed to be doing. You know, I've told this story before, but I'm absolutely delighted. I go out in Warrington, I get turned down in pubs. They say, no, we're full. I'm just thrilled at that. You know, the fact that they're COVID secure just fills me with delight. And when I went into the final pub, got in there, they were wearing their face coverings, they took my address, they were being very socially distanced, all the tables were far apart. I felt very safe, and I know everyone else felt safe as well. So how do we keep our schools going? How do we keep our pubs going? It's the spacing, the hand washing, the face coverings, but also thinking about how we can keep each other safe. So just build it into that routine. You know, keys, face covering, I've just come to a restaurant, maybe I should nip to the loo and wash my hands. You know, if there isn't, you could use the hand sanitizer, but why not just, you know, freshen up a bit as well? So these are the things we can start to do and keep doing more of, because we absolutely, as Russ said, we do not want to go into that level 3. We don't want to be closing things down, and we certainly don't want to be closing our schools down. That would be absolutely devastating. But in order to do that, let's keep following the rules. Let's be kind to our COVID community support officers who are going to help us. And that's about what I want to say. Our job, and you know, my partner said, as soon as he heard about the local restrictions, he said, "Oh, you better go out and get some more toilet roll." And I rolled my eyes and said, "No, that's exactly what we shouldn't be doing. We shouldn't be buying lots of toilet roll." So, you know, we all kind of have those panic moments. The IT doesn't work. Let's not panic. Let's carry on. Let's keep Warrington working, and let's keep our guard.
Thanks very much, Tara. I needed toilet roll when we crashed out of the cup to get to Salford, but I think we wish Salford all the best at Wembley on Saturday. Now, questions. We've had a few questions that have come in via the council's Facebook site, so I'll take the first one. It's from Otis in Latchford. Otis asks, "I've heard a lot about enforcement powers that have come alongside the restrictions. What does this mean in reality?" Well, Otis, what it means, if you break the restrictions, you're breaking the law and you run the risks of very hefty fines. If you are in a situation where you're in a group larger than 6, first time offence is £200, and if you continue it's £6,000. And the council will be working with the police, particularly around this weekend, to step up the enforcement arrangements. So the risk of enforcement is growing and growing day by day, night by night. Also, the same goes to businesses who don't comply with the 10 p.m. curfew. If they don't comply with that, they can risk a fine of up to £10,000. The COVID support officers have been mentioned. We are stepping this up. We want people to enjoy the nighttime economy here in Warrington. We want people to do it within the restrictions which are now enforced. Thanks, Otis, very much for your question. If we move on now, a question for Tara from Mark in Birchwood. Am I allowed to travel to other high risk areas and even into Liverpool, which is very high risk, Tara?
I can repeat what it says in the guidance, but I'd say, why would you want to? If you can stay put, unless it's an essential journey. If you need to go and for work purposes or to go to school and you're in a high risk area, you can't not do that. But otherwise, the advice is stay put if you possibly can. Try and avoid as many trips as you know. Don't just get in a car. You know, I really wanted some compost over the weekend, and I really like going across the suspension bridge in Mersey and the Mersey suspension bridge. I was like, no, Tara, that is not a good use of your weekend. Just stop yourself, because you could go for work and school, but the advice is, if you're going to try and travel into the Merseyside area, which is very high risk, don't. And Holton is also very high risk. So please try not to travel unless you absolutely have to. Thank you.
Okay, thanks, Tara. A question for Russ now from Jamie in Woolston. Jamie asked Russ, why did we initially ask the government to be in tier 2 rather than tier 3 like Liverpool and the surrounding city region? Russ.
Thank you, Stephen, and thank you to Jamie for the question. I think the simple answer is because the context of COVID in Warrington is very specific to Warrington. We understand the data, we understand where outbreaks have occurred, we understand the nature and specifics of the spread of COVID here in the town. But I think more fundamentally, Warrington isn't part of a big homogenous area. We're not part of the Liverpool City region. We're not part of Merseyside. And those arrangements that have been put in place for the Liverpool City region were agreed with the leaders in Liverpool as being the right measures for Liverpool City region, but they're not necessarily the right restrictions for us here in Warrington. I think that the restrictions we've got currently that we agreed with government over the weekend are a set of restrictions that will work for us, certainly in the near term. We're constantly monitoring the situation with our public health colleagues and our colleagues in the NHS more generally. We're looking at the data on a regular basis, and we're continually assessing and reassessing the COVID situation here in Warrington in the context of our town and the restrictions that should be in place and could help us to bring this under control. I think earlier on I said at this point in time, Tier 2, the high risk category, is absolutely the right fit for us, but it isn't a fixed position. We have to be prepared to move in accordance with the data and the evidence that we're seeing on the ground, and we need to respond to that quickly to ensure that if we need further restrictions, that we can do that and we can get the full support of government to be doing that as well. I don't want to be dragged along by other regions. I don't want us to be swallowed up into a larger patch by default. I want us to make the right decisions for Warrington, the right decisions for all of our residents, but especially for our businesses in the hospitality and leisure sector. I think we've got a duty to them to make sure that they're adequately supported, that if it's safe to use the hospitality and leisure sector, that residents can still do that, and that we don't crash our local economy on the back of a misguided move into a higher category than we absolutely need to adopt. So at the moment, Tier 2 is right, but that situation is under review, and that's why I said it really does need everybody to play their part to ensure that we get this situation under control here in Warrington as quickly as possible. Otherwise, it is inevitable that we'll need more measures.
Okay, Ross, thank you very much. Question for you now, Simon. This question's from Tina in Lim. She asks, what happens if the intensive care unit beds all fill up? Will all the procedures be cancelled?
Okay, thank you. If I refer you back to the summary I gave at the beginning of this broadcast, I talked about where we were at in terms of current intensive care unit capacity. And as I said, our current escalation capacity is around 26 beds in critical care. Now, we have got plans in place if we need to increase that further on an incremental basis over the coming days and weeks, up to potentially a maximum of something like 54 beds in critical care, which is quite significantly different from our baseline. The other thing that we do on a daily basis is have a system of mutual aid with other critical care units in the region, and we share patients and we transfer patients when necessary. For instance, yesterday we transferred 2 patients to Leighton Hospital as part of a well-established transfer process that happens whether or not we're in the midst of a pandemic or not. So we can rely on the mutual aid from other critical care expertise in the region. We are reviewing the situation with our planned procedures on an hourly basis, actually, with a very good expert multi-professional team looking at everything on a case-by-case basis to make sure that we make the best use of the capacity that we have to look after our COVID patients, our non-COVID emergency patients, but also those planned procedures that may need critical care. And that is being reviewed, as I said, pretty much on an hourly basis, actually. And I've confidence in a genuine multi-professional team approach that makes sure that we do the right things for all of our patients without adversely affecting one group above another. It is something we keep under constant review. There really are only 2 reasons for us needing to cancel procedures, and that's because of staffing constraints or bed capacity constraints, and actually often it's staffing that is more rate limiting. And as you might imagine, the vast majority of our staff come from the local population of both Warrington and surrounding areas, and therefore are affected by the community prevalence of COVID-19, just like everybody else. They come from that population, and therefore they're just as likely to be affected, and therefore staff sickness for us is something that is obviously under strict oversight and monitoring. So we really will be monitoring this on a daily basis, and keeping the number of cancellations of procedures to a minimum, and only doing it where it has a beneficial effect on either staffing or bed capacity. And generally it's not beds that is rate limiting. I hope that answers the question.
Simon, thanks very much. That very detailed answer is very, very reassuring. So thank you, Simon. Last question for this evening is to Andy Davis from Val in Orford. I'm 55, Val says, and my husband Steve is 63. Should we be having a flu jab this year? And if so, when?
So thank you, Steve, for that, and I hope that both Val and Steve you're doing well and keeping well. Yes, it's important this year, and I'll explain a bit more why. So flu vaccines are given every year to at-risk groups, and that's usually people over the age of 65, pregnant ladies, and other people with long-term conditions or care and support needs. And those individuals would usually be invited or be aware and be told to book in each year for the new flu vaccine as that becomes available, usually from late September, early October. So those groups that would usually have the flu vaccine are being prioritised first because they're the people most at risk and most likely to benefit. However, during the COVID pandemic, it's been identified by the Joint Vaccine Committee that it's of benefit to vaccinate people in a wide range, so over 50 and up to 65. So there's a second phase of the vaccine programme for flu that will be coming on probably mid-November, and as the supplies become available. And for those who don't know, the vaccines that we give as part of the winter flu campaign are usually ordered sort of very early in the year, January, February time, after the closing down of the previous year, so that they can be manufactured. So the supplies come through in different phases, and there's been additional supplies put forward to help expand to the over 50s. So you are both in the age category that you should get a flu vaccine this year, but we are prioritising those that are at risk first and would be usually part of the vaccine programme, and then followed on by those additional cohorts of people such as yourself and your husband Steve.
Andy, thanks very much, and I just thank everybody for participating, Russ, Tara, Andy and Simon, and to say sorry about the technical issues with running these broadcasts, not with Hollywood budgets or even those of Netflix, but we look forward to seeing you again in the future. Thank you. Good evening.
Thanks. Good night.